World Kidney Day, of course, is to raise awareness for the conditions that impact our kidneys. The two main causes of kidney failure are hypertension and diabetes. So, of course, checking blood pressure, especially for Africans, is very important, and keeping blood sugar down as well. So we're here, and really prevention is better than cure. The cost of dialysis and drugs, considering the exchange rate devaluation now, is extremely high. So prevention is even more important now than it used to be over the last few years. And of course, we continue to raise awareness, raise money, continue to support patients with drugs, and working towards dialysis and even kidney transplantation, etc. Kidney Foundation for Africa was founded in 2009 by Dr. Bosede Peter. She had kidney failure, and after her transplant, she founded the foundation to basically raise awareness, educate people, and also care for post-kidney transplant patients with medication, counseling, etc. And so we've been out here now for over 20 years or so doing this good work. And yes, this is the walk for Kidney Foundation for Africa 2025.
The kidney is very important in our body because we also need our kidney because they're also an organ of our body. We need them. And I also think we need to take lots of water to keep our kidneys intact.
More or less like our social responsibility to the society. The World Kidney Day needs to be celebrated, and we have a lot of people who are either mentally sick or have kidney issues or anything. So we need to collaborate in order for us to extend hand of fellowship.
I'm just participating for the first time, and I do realize the imperative of bringing much of what is being said here today, to mind. That many of us have these things on the fringe of our minds. We know that we are supposed to live responsibly. We should be more sensitive, to keeping ourselves healthy. Theoretically, we know, and very many times we think we can do it anytime. that I'll do it soon. I'm going to reduce my weight soon. I'm going to get more serious with exercises soon. I'm going to cut down on on salt very soon, and so on and so forth. But it needs an initiative like this, to actually make us realize how imperative, the actions are.
This year, we are partnering with the Society of Nigerian Artists Lagos branch, because in the past, shall we say 24 months, they've lost quite a few artists. Kidney failure, a stroke here. So we need to rediscover the right lifestyle for life, longevity. Because I say one thing, yes, a car can knock you down. They say something must kill somebody. A car can knock you down, but if you are alive, the quality of your life must be enjoyable. Okay, if you are alive, you must say the quality of life must be there. And therefore, it's good to make people aware that the kidneys are very important.
Yay.
Indeed.
Yeah.
World Kidney Day there.
That was, it's usually commemorated on the 13th of March every year. And this year, the theme for this year is prioritizing early detection for healthy kidneys. So they're saying that it's important for you to go do your early checks for your kidney.
That was actually organized by Adam and Eve.
Yes.
And I think that's quite commendable.
Yeah, very.
So
very
the question
much.
going around now is, are your kidneys okay?
Yeah.
So the thing is, it's not a conversation people bring up much.
Right.
Nobody's like, oh, how are your kidneys? It's not, there's some things you ask about, but nobody ever asks about that. And we actually don't understand how important the kidneys are. And the fact that, well, God is so wonderful. God made it possible for people to survive with just one. So if you are conscious about your kidneys and understand how to look after your body a little bit better, maybe you might be saving a life of someone else as well one day.
Absolutely.
So World Kidney Day, thank you to Adam and Eve for putting that walk together, and hopefully it's spreading the right amount of awareness.
Right.
Yeah. And then good morning, Mary.
Hi, how you doing?
I'm
good morning.
How are your kidneys?
My kidneys are doing well.
You see how random it is? It just feels so random.
So I intend to get the, KFT done soon. So hopefully I can be on top of it.
Okay.
Yeah.
So I asked that just to put it in context that it's not a question we ask all the time.
Yeah.
But it's great to see you, Mary.
I actually realized that people who drink ask themselves that a lot. I've heard them ask one another, how are your kidneys? And it's kind of like a
Titi
joke.
feels
I don't know
out.
the inside joke.
Yeah.
What?
Titi feels
Thanks,
called
Mary.
out.
No, oh no. No, I didn't mean it that way.
So I've recently made the switch to Zobo tea as opposed to coffee because I don't know, Mike and even Mazina back in the day used to call my coffee really strong.
It takes everything hard.
Yeah, really. Wow, really. So
Wow.
I had to switch up to Zobo tea because of a recent health check where my doctor was like, your body is telling you something. If you like, don't listen. And it's just one of those conscious things. You're not actually just doing it for yourself. You're doing it for your family, for your loved ones.
Yeah, there's some of the signs that we need to pay attention to, and that is water retention in our body. So, for example, if you're having a part of your body is swollen, especially your feet, you need to go for a check. It's a sign, and it's telling you to go for a check. And we always like to delay some of this. We see the signs as, I'm tired. Oh, I don't have the money. Oh, I don't. But thankfully, we have NGOs now that are, organizing events like what Adam and Eve has done with tests. Where you can get your tests done, do these checkups, and and just to ensure that you're okay. And if there are any signs, or if whatever we got, which also depends on whatever the tests say, you can go to a hospital and get it done. There are a lot of general hospitals because before people come and say, oh, it's expensive. General hospitals are
it's just the queues.
Many
really,
ailments can actually be fixed if detected earlier.
early, right?
And that's why two things people should never play with are their KFT and LFT. That's kidney function test and liver function test.
True.
Listen, getting those tests done at least annually
Yeah.
will save you a lot in future.
There's also something else that can save you a lot.
What?
When you get to a supermarket, for instance, don't go into the snack aisle, but go into the fruits and vegetables aisle first and spend a larger amount of your budget on
The challenge
healthier
with that
veggies.
is you could buy it, does not guarantee you would eat it. It's one thing to buy fruits and vegetables.
If you spend
It's
most of your
another
budget
thing-
on it, you eat it. Oh.
No. So
I
it's
think you
important
will.
to find ways that you would find them interesting to consume.
Yeah.
Put them in areas of the house that when you want to reach for a snack, you find yourself touching grapes or carrots instead. But if you don't do that, your
So, you know,
snacking game has just begun.
I was actually doing what I could to segue into something we saw on online yesterday, but we will have to wrap it up here. We'll probably talk about it tomorrow. But yeah, add some herbs, some fruits, leafy vegetables to your diet, and you know, you might be keeping that doctor's appointment a bit further away.
Yeah.
All right,
and I
then.
think this is also a reminder to go get your kidney checked.
Yeah.
If you haven't done that, if you haven't done any of the tests, there's a lot of information online. You know, go do your research, and most importantly, try and see your doctor and see how you can get your kidney checked.
Okay. So yeah, when you get to your office today, ask your colleague, are your kidneys okay?
Yeah.
Hopefully you end up alive.
We'll take a quick break at this point. We will be back after this.